হেঁটে এসো আরেকবার, আস্তে আস্তে হেঁটে এসো। সি যে ওয়াকিং, ওদিকে যাও, আস্তে করে এসো, আবার এসো, মাঝখানে বসো, ওখানটায় বসো। Difficult to sit, difficult to walk, and getting up is very difficult. ওঠো। See, the position of getting up is very painful and troublesome.
Yes, আমি ঠিক করে নামাজই পড়তে পারি না।
So this is called DMD or Duchenne muscular dystrophy. I have shown many cases of Duchenne muscular dystrophy where the muscle protein dystrophin is not made correctly, with the result that severe muscular weakness develops. These are genetic diseases. These are genetic disease. Genetic disease. As the abnormal genetic codes are inherited from the patient's parents. From the patient's parents. The amino acids, unlike carbohydrates and fats, cannot be stored for future use. However, amino acids are released from a number of tissues, particularly muscle protein. Particularly muscle protein.
That is stored.
Muscle protein. Particularly muscle protein. In times of need, such as during starvation or in the course of serious illness, infection, or after an operation, and these amino acids then become available to produce proteins needed during the illness, and muscles is slowly lost, that is wasting of the muscles.
Yes, wasting all the muscle.
Wasting of the
Of the
muscles.
muscle.
মাসেলগুলো ক্ষতিগ্রস্ত হয়ে যায়। মাংসপেশিগুলো, শরীরে মাংসপেশি, তুমি যখন গোস্ত খাও না, মাংস, তোমার মাংসপেশি নষ্ট হয়ে যায়, কাজ কমে যায়। The amino acids which are not used for repairing and the building up of the tissues are broken down into the liver and forms urea, which is excreted in the urine. There is a number of rare genetic diseases, each of which is due to abnormal metabolism. So this is about the Duchenne muscular dystrophy. So remember, my friends, about the DMD or Duchenne muscular dystrophy that cause progressive weakness and loss of muscle mass. The disorder differs in terms of which other disturbance of the muscles dystrophy. Because here the most important and most severe factor is severe damage of the muscles is associated with progressive decline in mobility. আমি দেখালাম বাচ্চাটা মোবিলিটি, মুভমেন্ট প্রবলেম হয়ে দাঁড়ায়। Later on, if the condition is increases, there may be cardiac dysfunction due to cardiomyopathy and respiratory failure requiring respiratory support as the disease advances or progresses. Female carriers of the DMD is the gene mutations. The survival rate until their late teens to early 20s. And those with less severe muscular dystrophies survive until 30s. So patients with DMD usually require social and financial support. It is important to consider end-of-life care plans with patients and family members, involvement from palliative care teams, as well as psychological, spiritual, and wider non-medical support. So our homeopathic treatment, the child is progressing by our medicine phosphorus. Phosphorus already given in 50 millisimolar scale of potencies, 1, 2, 3, 4, 5, once daily in the morning, and the patient is slowly improving. This patient is brought from the Chuadanga district of Bangladesh, and slowly, gradually, the child is improving, and I do believe the child will improve. So let's see the result. May God bless the child.